In the next 24 hours, domestic flights will commence at the Nnamdi Azikiwe International Airport and the Murtala Mohammed Airport in Lagos.
The Port Harcourt, Owerri and Maiduguri airports will begin operations on the 11th of July, while flights will resume in other airports across the country on the 15th. Already, aircraft are undergoing thorough cleaning from nose to tail and disinfecting them.
The procedure is for the safety of passengers. Passengers are advised to follow all safety guidelines and protocols put in place to ensure that the airports do not become channels for spread of the coronavirus.
Well, joining us via Skype is managing partner Aglo Aviation Support Services Limited, Tayo Ujuri. Good morning. Thank you for joining us in TVC
Good morning,
Breakfast.
Tayo.
Good morning.
All right. 24 hours to the resumption of domestic flights. How confident are you that the measures put in place by the government will ensure that passengers are safe?
Thank you. Good morning, and it's an honor to be here, as always. It's like, I'll put a background to this because it's a virus that is novel in nature. It's not even compared to the Spanish flu because the world wasn't as connected in the 1918s then. But now we have a global connected world, and we have aeroplanes that fly every hour, even every second. So with that put in place, what has been put in, with that said, what has been put in place is the fact that we now have a layered approach from the technical aspect, from safety aspect, from the crew, the airlines, the aircraft is being cleaned, then the procedure for the public health to ensure that the traveling public are kept safe during the flight and during the facilitation process, from the drop-off to the airport, to the check-in process, security screening process, and to flight and arrival on the other side.
All right. The Minister of Aviation, Hadi Sirika, has said that anyone who is going to fly should be in the airport at least 3 hours ahead of flight. Can you walk us through some of the procedure that anyone who gets there, what processes will the person go through before boarding?
The background to this was we had the simulation about last 2 Saturdays ago, and with that simulation, it shows what the new process is with the new normal for protocols, where you have to wash your hands, you have to ensure and enforce and ensure social distancing. We have to make sure the masks are on, and with the social distancing, you have to go through the screening machines, wash your hands, sanitize, and ensure that the public areas, public spaces are cleaned intermittently. So this takes time, and with that process, it will take longer time for people to check in, to go through security, and to have their bags disinfected prior to being boarded on the aircraft. With that said, we now see with that process, it will take longer for you to board an aircraft, about 120 passengers, longer than if it was just a normal norm. So that's why the traveling public are advised to come 3 hours. But this is a startup process. With the 3 hours process, repetition is the mother of skills. We're going to look at the gaps. We're going to look at the loopholes in the process, and we're going to ensure that it's better so that the dwell time at the airport is reduced and ensures a pleasant passenger experience while ensuring safety.
All right, so how do we ensure that physical distancing is maintained at the airports, especially before boarding?
Thank you. That's a very good question. With the simulation, you have the spacing. You have indicators on the ground that actually marks the 2 meters separation. Then with the check-in, the screening as well, you have that separation. And then when you're sitting, waiting in the lounges or the boarding areas, the chairs are demarcated such that you have the space across where people are not allowed to sit together. With the mask and that spacing, it's actually going to ensure and mitigate the risk of coronavirus or COVID-19 spreading. And we all want to ensure that aviation is not a vector to the spread of coronavirus.
All right, let's talk about the plane itself. The sitting arrangement, where a lot of people are concerned that if the planes are not reconfigured, the sitting arrangement will get people so close to each other. What has been done in that regard?
It's very objective studies have been done about this, and the studies show that one, the air filter, the air purifying system within the aircraft has been ensured that purifies the air and ensures that fresh air comes to the aircraft as the plane flies intermittently. That is one step. Secondly, they have the you have the thermal cleaning, which actually disinfects the aircraft electronically. This is the second step. We also have the facial mask, which ensures that the spread is curtailed. With the mask as well and the airflow, we actually ensure that this is not spread. And within the seating arrangement, the way we sit with the aircraft seating arrangement is it actually restricts and mitigates the spread of the virus.
All right, the minister advised passengers to ensure that they make use of their face masks while at the airports. But are there considerations for persons who might have one medical condition or the other, especially during the flights?
Yes, that's been put in place, and that's been part of the result of the simulation process. The last seat or the last few seats, depending on the number of people that have health conditions or existing health conditions, has been designated as isolation seats. With those seats, you're actually being able to take care and provide the necessary health solutions or health remedies for the traveling public. This is actually not. This is in association or tied to what the NCDC protocols are indicated. So the NCDC protocols indicate that if you're over 65, you should not move about. So those protocols are actually enshrined in our procedures as well to ensure that those that are at risk are not traveling as well.
All right, Tayo, in India, as flights resume, the serving of food on board has been banned or prohibited so far in flights within India. Are we going to have the same situation in Nigeria?
Yes, we are going to have that. We already had airlines indicate they will not be serving food because most of the flights are within 1 hour to 1 hour 30 minutes of flight time. With that time frame, they're trying to reduce the social contact with human beings because that's the easiest way it's spreading. So the crew are all dressed up there in PPEs, personal protective equipment and gears. So to restrict and mitigate that risk of spread, the serving of in-flight catering would stop, and that's actually going to help with the economic viability of the airlines as well.
Now, do you have concerns that perhaps passengers might not stick with the regulations in place, especially when you see what is happening across the country? Despite precautionary measures given by the federal government, a lot of Nigerians are still not taking responsibility.
Absolutely, I do have that reservation, and the Honorable Minister of Aviation did highlight that in his speech yesterday during the PTF briefing. He did mention that Nigerians and human nature, as it were, would show itself, whereby people want their protocol officers or their personal assistants to go all the way with them. But we're actually advising and pleading with the traveling public in the interest of the larger team for everybody to ensure and take responsibility by ensuring that the process is adhered with.
All right, talk to us basically, the precaution that the airports are taking now is to prevent and ensure that nothing happens and then to prevent the spread. But in the case where in the midst of this procedure, one is found to have COVID-19, what are the protocols in that regard?
Thank you very much, Mike. Actually, this part of the simulation, you have lots of moving parts and you have lots of organizations, particularly the Port Health, that is actually part of this process. The Port Health looks at the health perspective for the traveling public. So the Port Health and the medical team within the airport is all set up to ensure that the traveling public prior to traveling are tested, the temperature is taken, and sanitization is ensured prior to traveling. And during travel, when we actually realize that there is a symptomatic patient on board. The crew has actually been trained as well. Most of the crew prior to the takeoff process have been trained by NCDC, and these are part of the training they've gone through to ensure that they know how to handle passengers during flight and on ground.
Now, for passengers who fail to meet up with the regulations, what measures are put in place by the airlines?
The airline, according to the NCA regulation, has the right to deny passenger boarding, has the right to restrict the passenger from taking that flight. And actually, if the passenger is on board, they have the right to actually ensure the passenger is removed from the aircraft.
All right, now from the videos of the simulation that was sent out, a lot of people raised concerns from the fact that there is no provision for people with disabilities, especially in the areas where there are sinks for washing hands and also hand sanitizer dispensers and all of that. Talk to us, what is done, what's the consideration for people with disabilities?
To the best of my knowledge, the hands-free hand washing equipment is actually within level for whatever form of disability that the person has, and from the thermal temperature or the temperature screening, that's actually done by hand. So what you have someone screening, and that person can actually adapt to whatever need of that patient or the traveling public. Then we actually, prior to this time, the airport is so designed and configured to address different forms of travelers. So this has actually been put in place as part of the simulation and part of the operational procedure.
All right, Tayo Juri, we'll leave the conversation here now. Thank you for speaking with us.